Hi, my name is Dr. Luis Garcia. I am one of the general surgeons here at the University of Iowa Hospitals and Clinics, and I'm going to spend the next couple minutes talking with you about ventral hernias, going over what is a hernia, the two different types of ventral hernias, and then briefly going over how we treat patients with hernias. A hernia is basically defined by any condition where there is a hole in the muscle layer, and you have intestines demonstrated here in the green line that protrude or push through that opening in the muscles, causing a bulge. And a bulge is the most common sign or symptom that patients have at home that they first notice. There are umbilical hernias and incisional hernias. Umbilical hernias is basically a protrusion of the intestines through someone's belly button, and that usually happens as people get older. The belly button area gets weaker and causes a hernia. And incisional hernias are by far the most common and result in an area where someone has had a previous surgical procedure done, and that area has become weakened and develops a hernia. When we think about the treatment of ventral hernias, the only definitive treatment that we have is surgical. These hernias will get bigger over time, and they will not go away on their own. When we think about surgery, the two goals of surgery involve closing the hole or suturing those muscles back together so that the hole is gone. And then we place a piece of mesh over the area which acts to reinforce the area, preventing the chance or decreasing the chance that the hernia will come back in the future. To accomplish those two goals, we have two ways to do that. We could do it laparoscopic, meaning suturing the muscles back together, do that, or we could do it open, which involves a bigger incision, but again, we accomplish the same things. Several factors that might influence how we approach your hernia depends on the size of the hernia, other medical problems that you may have, as well as the number of surgeries that you've had in the past. All those things will influence which approach that we take. Here at the University of Iowa, we have a dedicated group of surgeons, including plastic surgeons, minimally invasive surgeons, and general surgeons, which have a special interest in patients with hernias. And if you have any questions or any information that you might want, please give us a call, and we would be happy to schedule an appointment for you here at the university.